everyone, and welcome. I'm Dr. Lianov, and welcome to this podcast of the Global Positive Health Institute, where we look at all topics related to lifestyle medicine, positive psychology, health and well-being, and this emerging field of positive health. And so today I'm delighted to have with me Dr. Jasdeep Saluja from Victoria. He is the co-founder and chief medical officer of Aroga Lifestyle Medicine, and we connected through the American Board of Lifestyle Medicine and our lifestyle medicine community, and it was a delight to meet him in Victoria over the summer, and he does such great things related to lifestyle medicine and positive health. So welcome.
Awesome. Thank you so much, Liana, for having me on your podcast today. It's been a great journey and getting to know you so far with all the work you do, and it's full of gratitude for the work that you've been doing all these years that have allowed people like me to get into the field and get to practice a way of medicine that we can be passionate about. Yeah.
Terrific. Well, lovely. Let's dive in. Can you share with us what grabbed your attention to this field of lifestyle medicine, positive psychology, positive health and well-being?
Awesome. For sure. So, back in 2012, I was finished. I was in my last year of my internal medicine residency. I was on elective back in home in Toronto. And my dad actually ended up having a stroke while I happened to be there. And got into the hospital. He had amazing care. He required an operative intervention. By the time he was discharged from the hospital, he had zero deficits, neurological deficits. Walked out and was put on all the secondary prevention medications, and nobody spoke to him about anything about making any lifestyle changes. And I didn't know any better either at the time, and so we just continued living life until 2015. Where I ended up driving him to the hospital again with chest pain, and turned out he had a heart attack. Again, an easy intervention with angiography, and he felt like $1 million came out of that, with slight changes in medications, but other than that, not really any advice given about potentially looking at diet, lifestyle, or anything. And so it was at that point in time I started looking at his health in a different way. I realized my dad's youngest of 5 brothers. 2 of his brothers had passed on with early cardiac events. I myself was 45 pounds overweight, feeling tired and sluggish, brain fog, working long hours, cholesterol not being the best levels. And so I started saying, okay, is this the destiny that I have and my family has, or is there something that we can do to help affect some change here? And just searching on the internet, really, I got to finding Dr. Dean Ornish's work and Dr. Caldwell Esselstyn's work and Dr. Colin Campbell, Dr. Neil Barnard. Started looking at this whole field of lifestyle medicine. Started making changes. Firstly, primarily at that time focused on what I was looking at was dietary changes. So kind of went, whole foods, plant-based diet, started, incorporating more exercise into life. In that time also I'd moved to Victoria, and found some profound changes in our own life. I lost, the 45 pounds I needed to lose. My cholesterol has been hovering below normal for the last few years. The energy came back, no longer having brain fog, not tired. My own dad's health improved significantly. His numbers got better, and his doctors were trying to figure out how that happened. He was requiring lower doses of his medications. He currently walks, 8 to 10 kilometers a day. He works out with a trainer, at least a couple of times a week, travels. He's in his 70s, and doing well otherwise. And so in 2015, at the end of 2015, when I moved to Victoria, started, at the hospital. Initially, I was just, doing an internal medicine clinic at the hospital and doing the cardiac prevention or cardiac chest pain assessment clinic. And when patients would come in and they had negative treadmill tests, if they had significant cardiac risk factors, we'd, talk about pharmacotherapy for, diabetes and dyslipidemia, hypertension. And once I started changing my own lifestyle, I started talking to patients about this and saying, hey, we could start you on statin therapy today, or if you wanted, we could wait 3 months and actually work on, a portfolio diet or some type of dietary changes that may help. And I had patients taking me up on it, initially, doing that for about 6 months, and 6 months down the line, I met one of my colleagues who actually is the doc that hired me out to Victoria. And him and his partner, they had been making the same type of changes in their lives, and he'd start talking to patients about it. And that's sort of where we came together and said, hey, it'd be awesome if we could support patients in a team environment, because we both recognize that as doctors, we had a certain skill set, but at least at that time, I didn't know anything about health coaching. I didn't know anything about, maybe not prescribing, lifestyle interventions, but actually, coaching patients through it and helping, with, motivational interviewing at a deeper level. And so that's when we started Aroga back in 2017. And so it's been a journey of since 2017 up until now of just diving into lifestyle medicine. And it's interesting, when I first started lifestyle medicine, I really started with the more focus on the dietary and exercise interventions, and then started learning more about sleep, and then eventually realized that, probably the most important part of lifestyle is the positive health part of things and positive psychology. And it's been, in a large part, that's actually, due to, the influence of, first movers in the field like yourself, right? And some of the ACLM conference talks that that were given, like even especially in 2021, about looking at the upstream pillars of lifestyle change and lifestyle health, and meaning of life, having meaning in your life and having a sense of purpose. And so I find nowadays that I spend a lot of my time with patients talking about their why. First and foremost, and I have an entire team that can help with all the other pillars. But I think it's you put the change process or the health process goes a lot faster, a lot more, or even not even just goes faster, but it's a lot more resilient, because one of the things that we stumbled upon initially was that you could get people excited about making lifestyle changes, but and they would start working on things, but when things happen in life, they revert back to old ways of coping mechanisms, and that to me was it was a sign that I'm missing something, and we're missing something in helping our patients develop tools around for resilience. And I think positive health, positive psychology interventions really help patients build the resilience so that they can continue to go forward.
That's well said. And this underlying challenge that we have, that we've personally, all of us experienced, and as health professionals helping our patients, is the sustainability of behavior changes. It often sounds great and sounds exciting, but then we easily can, like you say, run into roadblocks. And then how do we overcome those roadblocks? And what I've learned, there's many pieces around supporting that behavior change. But the thing I learned that really excited me about linking healthy lifestyles, lifestyle medicine with positive psychology is that those positive emotions, through that broaden and build theory that researchers like Barbara Fredrickson have been putting out there, we can open up and be really more solution focused and find ways around those barriers and persevere. And so, yeah, it's so integral to really helping ourselves maintain this for a lifetime.
For sure. Absolutely.
Yeah, and so you're shared a little bit about your personal experience in losing weight and your father, and I also know that you and your wife you run meditation retreats, and you're very much into the space of mind body. So share a little more about that, and also how then you guys are using it in your personal lives.
For sure. I mean, I grew up in a family that attended meditation retreats on a regular basis. So it was something that we did all through life. There was a time when I didn't for a while, when you're busy with school, and you all go through a phase where, like, what you've grown up with, you sort of say, I probably don't need this. And then a few years, maybe a decade of life experience teaches you that you actually do need it. And so it's something that we try to implement within our regular lives try to keep a daily practice. I'm not always successful at it by any means, but it's something that, is a guiding light for me to trying to keep that practice going. And with us, the way way the meditation retreats run, it also is a big sense of community. And so, a lot of people that, attend are people that you end up getting to know quite a bit well, and you can lean on them from support, from a mindfulness based support and spiritual support, rather than not necessarily like practical everyday support, but it's more like, how you feel, and it helps you in how you approach life. Helps with at these retreats, it's all volunteer run, so everyone's engaging in some type of service to others. Again, that's more positive psychology there, and then just practicing gratitude, right? These are things that you're almost taught all the time, to practice all the time. And so it's something that I'm able to talk with patients more about in terms of the gratitude part of things, just because it's kind of forced for me to practice it, right? And actually, in the last few years of practicing lifestyle medicine has forced me to also be more mindful of how I'm living my personal life, because I really can't look people in the eye, especially my clinical in the office, saying, hey, I think these are things that are going to help you, if I have like zero interest in engaging them in myself, right? And it's one of the reasons why if I haven't, like, it's been a late night, haven't slept well, I'll still get to the gym, because I will be, that's what I'm going to be talking to patients about the next day, right? And so I think this is great. It's a symbiotic relationship, but I actually thank my patients all the time. Like, patients will be like, hey, thank you and the team. And I'm like, actually, thank you, because if I wasn't doing this, I don't know what life I'd be living. Right. And so the energy exchange and that positive exchange of, ideas, it goes both ways. And it's actually really fun. I've had, I had a patient, for example, talk to me about, since retirement, having had lost her sense of purpose. They're a very, very smart patient, very high level administrative service work. And I found out, asked about what are you passionate about, and she's in a previous career, she was a chef, and she actually has those skills. And so making a lot of the dietary changes was quite easy for her. And I was like, well, would you want to get involved in terms of in doing cooking demos for other patients? And like her eyes light up, and it's like, obvious, for sure, right? And so the fun thing is, like, sometimes you don't know, actually, the patient in front of you is actually going to maybe become an integral team member of spreading positive health and across the community, right? And so you always have to look at it from that eye. It's not always us helping everybody else. Actually, there's an opportunity to learn from the people in front of us as well.
Yeah, absolutely. And just fully engaging in the community. And I think Aroga Lifestyle Medicine seems to be, you have these ripple effects in your community, which is wonderful. So I love that, learning from our patients. And it is a two-way process. And in positive health, that's called the positivity resonance. So it's healing us, it's healing them, and it's healing broader groups that are involved in that synchronous process, emotionally, mentally, and physically. So that's lovely. Is there one favorite tool in positive health for you that you usually turn to?
In terms of like what I guess a lot of times, so I get a lot of referrals for people struggling with the weight gain and prediabetes, diabetes, and a lot of them have dealt with lots of judgment and in the way they feel about themselves. And so one of the things it's not a formal tool, but what I use is, like, when someone talks to me about why they want to lose weight, and how they feel about themselves, and especially when it comes in a bit negative, I'll just switch it to them. I said, if I, ask them a question, like, if I was to survey your best friends and your loved ones about everything they loved about you and their favorite qualities about you, what would they say? And all of a sudden a list comes out, right? And I say, I go and so we'll identify, in doing so, we'll identify a ton of strengths, especially when they think, I don't know if I can do anything. Well, it says, like, and you've done this, and this. It's the exact same strengths, the exact same qualities that will likely lead to your success even in your lifestyle here, right? And making in lifestyle changes for your health issues, right? So it's getting people to recognize that they actually have way more strengths than they think they do when it comes to their health.
Yeah, exactly. And I love that you've mentioned strengths, because I often highlight that if nothing else is going right, you can turn to yourself and start there, because we all bring something to the table. That's lovely.
And then the other thing that I always actually all my patients know that I only have one rule for them to work with us. And the only rule that I tell patients is I don't care if you've made any changes or tons of changes, it'll never affect the way we work with each other. The only rule is that I really focus on practicing self-kindness and in your thoughts, words, and actions, right? So I always tell them, like, the one thing that you're not going to get any encouragement from me on is if you start talking about yourself in a negative way, you're not going to see me encouraging that conversation, right? And so because and again, a lot of people in our society, we're really well versed in having compassion and kindness for others. And for some reason, whether it's through trauma, whether it's through learned experience, we don't always feel that we are deserving of that exact same compassion and love.
Yeah, absolutely. It's interesting how we think of others first before ourselves, and it should be the other way around. Put on that oxygen mask on ourselves first. And we have a number of followers on this podcast that are from the lifestyle medicine community or the health professional community more broadly. And maybe they're incorporating some pieces of what we're talking about into their clinical practices. Is there any advice you have for them in terms of either a place to start if they haven't, or a place to really go deeper, to really meld these fields of lifestyle medicine, positive psychology, and positive health?
Yeah. Well, I mean, my go-to places for go-to place for a lot of my information is actually the ACLM, right? And like, and we were just talking prior to the start of the podcast how like ACLM has been integrating a lot more positive health into the programming. At the latest conference, we had quite a few sessions that were there. In fact, I attended one of your workshops from last year's workshop. That was a 4-hour post-conference workshop that you and some of the physicians had run. So I thought that was great. There's your book, Roots of Positive Psychology.
Roots of Positive Change. Yes.
Yeah,
Thank you for the plug.
Right. I have that book it's actually sitting on my nightstand. These are places to go. And then the other thing is also, relying on your team, right? Your team brings a lot of skill sets, right? So we have dietitians on our team. We have health coaches on our team. We have clinical counselors. One of my clinical counselors, the one that works with us, he's really big on identifying strength-based counseling for, patients, especially when we're dealing with old trauma as well, right? And so it's okay. We don't need to be the expert in all of this, but we need to be bringing on team-based solutions and then learning from each other, right? And the other thing that we do is, we have a journal club every month, right? Where various members of the team, it's not just physicians, our allied health professional colleagues, they will present papers and latest research, and it'll be from everything from nutrition and positive psychology to like trauma to, the benefits of exercise, sleep health, all of that, right? And so you got to just kind of engage in various activities to keep learning.
Yeah. I love the journal club idea, and I'm so happy that you guys are doing that here at the GPHI. We're actually going to be starting a journal club as well, because it's really invigorating to see the new science coming through and oftentimes validating what we're experiencing. That seems common sense, but it's good to validate it. And sometimes maybe we're a little bit off track, and that's why we need the science as well to adjust it and make it more impactful from that evidence-based perspective. So terrific. And so as we close this podcast, because we like to keep these very short, any parting words, any single idea that you'd like to leave with our listeners?
I guess as parting words, part of the biggest part of positive health for me is actually sitting there and listening to patients and making sure that they feel well heard, right? Because a lot of people, everyone has a story to tell, and they don't necessarily have listeners for that story, right? And I think it's important for people to get their story out and that story to be honored and celebrated. And the other part is like making this actually a fun experience, right? I always tell people to have fun with, not to treat lifestyle changes as something they have to do, as something, and more as something like like an adventure to go on, right? So have fun with the whole process, right? Health and wellness. If we're starting it from a positive approach and having, self-kindness infused in it, having a sense of adventure, having some playfulness in it, that's really gonna set them up for a win, right? And a long-term win. And I always tell patients, we don't want to take the first game, we want to take the entire season, right? And so it's all good. What happens in the first few games is just learning lessons along the way, twists and turns that they're always going to happen. Right.
Yeah, absolutely. But it's also well said, because that actually is the core of positive health, and the link of positive psychology with healthy lifestyles is we need that hook that's going to engage us for the long haul. And that hook comes from those positive emotions that we naturally want to go back and do these experiences, these fun, relaxing, happy experiences that we associate with beautiful and good tasting food that's also good for us, with the energy we feel when we're out walking in nature, etc. That then it's not a I must or I should, but naturally something you just want to go out and do. Yes.
Sure. Absolutely.
So I love it. Well, thank you so much for joining us for this GPHI podcast, Jasdeep Saluja, and hopefully we'll have you back again to share some more wisdom as things evolve and the lifestyle medicine positive health community evolves. I want to also thank our listeners to this podcast and followers. Please subscribe to the channel for the GPHI podcast. And we would love to see you again on another one of these podcasts. Again, awesome. Thank you, Jasdeep.
Thank you so much. Thank you for having me on, and thank you for the work that you're doing and really pushing forward with positive psychology, positive health and especially in the field of lifestyle medicine, where it needs to be the underlying pillar of all pillars. I know it's been a long road, and you've been working really hard, and I think you have a great team. I'm on the advisory team is there as well, and so it's appreciated work, and I think this is work that's going to pay dividends for our communities in ways we can't even imagine yet. So it's exciting work, and I appreciate it. And so you're very appreciated, and the work you do is very appreciated.
Thank you so much. And thank you again to our audience. Be safe, be well, happy until next time. Bye-bye, everybody.
Take care.